otherwise you can use the renal or the, because you'll be in a renal exam, the renal or the abdomen setting. But in this case, we have a prostate setting. Okay, so the prostate's location is going to be inferior posterior to the bladder, so it's very similar to where the vaginal canal is. So we're going to be kind of down by that pubic symphysis again. And so here's kind of the view that you guys are used to seeing for our transabdominal female pelvises. And if we just kind of use our eyes, here's prostate right in here. So he's got one seminal vesicle that's kind of creeping off right here. So the bottom of my transducer is right on that prostate, and then the top of it's more towards the right side. And then as I move across, we're going to open up to that left side, and here's the other seminal vesicle. Turn this down a little bit so you can see it. So prostate right in here, seminal vesicle. So when we do our measurements, we're going to kind of do that same thing that we did with the uterus. We're just going to pretend like the broad ligament or the seminal vesicles don't exist. And so we're going to kind of round that out when we do our measurements. You can see, because that pubic symphysis, how difficult it can be to image that more posterior aspect. So we have some options of maybe coming up here and trying to get a little bit more of that boundary, but he's always a little bit difficult to see. So let's
for like every patient or just
every patient, okay. Just because it sits so inferiorly, and that pubic symphysis always causes a lot of shadowing. So our first image is just going to be sagittal prostate, and again, you're going to see these going by on your renals. You aren't necessarily going to be imaging this specifically unless something catches your eye about it or it appears enlarged. It should be about 4 centimeters or less in all dimensions. So next up, we're going to put a caliper. So I'm going to imagine this as a circular structure. So here I have a little bit of seminal vesicles. We're just going to ignore that. And we're going to do a superior to inferior. Next, we're going to do an anterior to posterior. So there's our first set of measurements. So next, and this is pretty straightforward protocol, transverse prostate. It's that simple. And as we go in transverse, so this would be kind of where we do our vaginal canal images. So we're going to go all the way down. You can see this start to blossom out. We're losing a little bit of bladder window, so we can try to come up superiorly on that bladder and then kind of angle through and see if we can identify that a little bit cleaner. But they're never going to be kind of as clean as they are in the female pelvis. But in this case, we've got kind of more distinct borders. If I move towards that superior, we can start to see those seminal vesicles kind of coming off. So we'll go ahead and get our transverse image. So one image, straight across in the transverse plane.
And do you just get where it's the biggest?
Yep, the largest. And so he's at 3.72, very normal, and that's your prostate protocol. So now if I had something abnormal in there, calcifications, so if I have a patient who has bilateral hydronephrosis, so something's backed up from the bladder down, and I don't see, I may still have jets, but I don't see any stones within the bladder, I may go down to that prostate to see if I can identify a foci that's within the prostatic urethra. Like maybe there's a stone that migrated all the way down to that prostatic urethra and it's causing bilateral hydronephrosis.
But we don't check penis for stones?
If I don't see anything, you could continue to go. Yeah, you could go all the way down the urethra.
Okay, go to the
Okay.
I have never, thankfully I've never had to be, I've been having to scan penises before, but not for that. But yeah, I told you guys the Cochrane story. It was very, and then one guy like during intercourse it like slipped out and like bent.
Oh, God.
Yeah, I know.
Penis or the Cochrane?
This is the penis only.
Like
The Cochrane guy was wearing it for hours on end during Pride weekend. It just was worried it would fall off or something. But anyway, but yeah, like the broken penis, so like kind of a hematoma and like bulging out the side. But anyway, so that's your basic prostate protocol. And again, unless you see anything abnormal, no color, we just measure in 3 planes, so with and without calipers. So go ahead and take a few minutes, and then once you guys have all kind of tried the prostate thing, then I'll sit down on the machine with the male pelvis and we'll talk through scrotum. Of course.